everyone, welcome back. Ready for a deep dive? Today, it's all about the knee.
You got it. And not just any knee. We're going back in time.
Way back to medieval times.
To a case of osteochondritis dissecans OCD.
Exactly. OCD found in a skeleton from a Croatian cemetery. 9th century guy. Fascinating stuff. I'm Don, by the way, your radiology guy.
And I'm Marge, orthopedic surgeon and former PT. We both love geeking out about knees.
We sure do. And you can join us on our YouTube channel for even more knee deep dives. Like, subscribe, hit that notification bell.
Don't forget the comments. Tell us what you think about this medieval knee mystery.
Okay, so let's get into it. Our main source is this report from Acta Clinica Croatica, all about this skeletal case. What's really cool is this discovery could give us some clues about OCD today. So Marge, for those who might not know, can you give us a quick version of what OCD is and why knee specialists find it so interesting?
Sure. In simple terms, OCD is where a small piece of bone under the cartilage in a joint starts to die. The knee. Most common spot. This piece can detach and float around in the joint. Yeah, causing pain clicking, and sometimes the joint even locks up.
Not fun. But what's really amazing is that this condition isn't new, Marge. Wasn't there a surgeon, Ambroise Paré, who described OCD way back in the 1500s?
You're right. Ambroise Paré, considered the father of modern surgery, first described it in 1558. Amazing, right? Even after centuries, we still don't fully understand what causes it.
A real medical puzzle. And this medieval case adds another piece to that puzzle. So this skeleton was found in the Gluvin Cemetery, 9th century. What's interesting is this person was young, between 13 and a half and 15 years old. Marge, isn't that the typical age we see OCD developing today?
Yeah, adolescents and young adults are most commonly affected. And get this medieval case wasn't just one knee, it was both. Bilateral OCD, which is pretty rare.
Wow, bilateral OCD in a 9th century teen. Now that's a discovery.
The researchers looked at the lesions closely. One knee was missing the bone fragment, the other still had it in place. Can you imagine seeing these lesions after all this time?
It's like looking into the past. And what's even crazier is that CT scans of this ancient knee look almost the same as what we see today. It shows that even after centuries, the human body and its conditions haven't really changed that much.
Exactly. It makes you wonder, what can this case teach us about OCD today? What's similar? What's different? It's like holding a mirror up to our own understanding and asking us to dig deeper.
Love that analogy. Okay, let's talk about potential causes. The paper mentions a few things. Trauma, repetitive stress problems with blood supply. Now, you might think trauma seems obvious, especially back then. But the researchers actually ruled it out in this case, Marge. Why do you think they did that?
Well, think about it. If one big injury was the main cause of OCD, wouldn't we see it way more often in ancient remains? People back then were so physical all the time, manual labor. Their bodies were constantly under stress. If trauma alone caused it, it would be everywhere in those skeletons.
Makes sense. So if not trauma, what about repetitive stress? Could that lifestyle have played a role in this person developing OCD? We know overuse can cause all kinds of knee problems.
Repetitive stress is a good theory. We see it today, especially in athletes. Sports with lots of jumping or pivoting, basketball, tennis, dancing. All that stress can cause small injuries over time, disrupt blood flow, and maybe trigger OCD.
It's like a slow burn, years of wear and tear leading to a breaking point.
Exactly. It's not always a sudden impact. It's the gradual buildup of stress. And when you think about life in medieval Croatia, lots of farming and tough physical work, repetitive stress makes a lot of sense in this OCD case.
So repetitive stress is a possible culprit. But let's not forget about blood supply. I know from radiology that good blood flow is essential for healthy bones. What happens when that gets messed up, Marge?
Well, Don, without good blood flow, the bone cells can't get what they need, oxygen nutrients. It's like a plant without enough water. It withers and dies, and for bone, that can lead to necrosis, bone death, which is key in OCD.
And here's where it gets really interesting. The researchers pointed out a specific area in the knee that's vulnerable to blood supply problems, the lateral part of the medial femoral condyle. For everyone listening, that's the bump on the inside of your knee. And guess what? That's the most common spot for OCD lesions. More than just a coincidence, don't you think, Marge?
Definitely, Don. There's a reason that area is trouble. It doesn't get as much blood as other parts of the knee, making it more prone to damage, especially when you add things like repetitive stress.
So picture this, years of repetitive stress on the knee, plus a weakness in the blood supply to that exact spot. Seems like the perfect recipe for OCD, right? But could there be even more? Remember we talked about a possible genetic link to OCD. Could some people be genetically more likely to have these blood supply problems?
That's a great question, Don. And one researchers are still working on, Could some people be genetically predisposed to having a weaker blood supply in that part of the knee, making them more prone to OCD? It's definitely something to explore more.
And if that's true, then this medieval teen with bilateral OCD might not be so different from the athletes we see today struggling with the same condition.
A thought-provoking connection, Dawn. This ancient case makes us think about the complex roles of genetics, lifestyle, and anatomy in OCD. It's like a reminder that even with all our medical advances, there's still mysteries to uncover.
Well said, Marge. We've covered a lot in this first part. We've looked at the basics of OCD, traveled back to medieval Croatia, and explored the possible causes. But this is just the start. In part 2, we'll go even deeper into what this ancient case means for how we deal with OCD today, from treatments to prevention. So stay tuned. The best part is yet to come.
And don't forget to like, subscribe, and hit that notification bell so you don't miss part 2 of our deep dive into this medieval knee mystery. We're back, folks, ready for part 2 of our medieval knee mystery deep dive.
You bet. Still trying to figure out what this 9th century OCD case can teach us about this knee condition that just keeps on ticking.
It really shows you that even though medicine has come so far, the human body and some of its problems, they've been around forever. It's like we're connected to these people from the past through these shared experiences.
I like that, Marge. It reminds us that we can learn a lot from history. Last time we were talking about possible causes of OCD, and repetitive stress really stood out, especially when you think about how our medieval friend lived. As a former PT, what do you think about how repetitive stress might have affected their knees?
Well, Don, let's imagine life in 9th century Croatia. Lots of physical activity, right? Farming chores. All that involves repetitive movements, putting strain on the joints, especially those knees. Over time, all that stress could definitely contribute to developing OCD.
Makes you think, could the types of repetitive stress they had back then tell us anything about the cases we see now?
For sure. We don't have their day planner to know exactly what they did, but we can guess, right? Grinding grain tilling fields. All that bending and squatting. That puts a lot of pressure on the knee cartilage and the bone underneath. Could make them more vulnerable to OCD.
That's really cool. It's like connecting those old farming methods to the movements that cause trouble for a runner or someone lifting weights today.
Right. And this link between repetitive stress and OCD, we see it all the time now, especially in athletes. Think about runners pounding their feet on the ground all the time. Huge stress on the knees, especially if their form is off or they're pushing too hard. Leads to those tiny injuries we talked about. Disrupts blood flow, and over time, boom, OTD.
So the activity might be different, but that idea of repetitive stress, it's a constant throughout history.
Exactly. Knowing this historical context can really help us understand OCD today, how it starts and how we might prevent it. Whether you're a farmer from centuries ago or a modern athlete, it's all about proper biomechanics, good training techniques, and enough rest and recovery.
So important, Marge. It's not just what you do, it's how you do it. Speaking of things that haven't changed much, let's go back to blood supply to the knee. I'm always blown away by how complex those blood vessels are in the body. What happens when that blood supply gets disrupted in relation to OCD?
Remember that vulnerable spot in the knee, Don? The lateral part of the medial femoral condyle. It just naturally has a weaker blood supply than other parts of the knee. Makes it more sensitive to damage, especially with repetitive stress.
Right. Almost like that area is just asking for trouble, even without a big injury.
Exactly. Now think about years of repetitive stress on top of that weak spot. Those little injuries we mentioned, they disrupt the blood flow even more. And without enough blood, the bone cells can't get what they need to stay healthy. It's a chain reaction that can end in bone death, the hallmark of OCD.
So it's a double whammy. An area that already struggles with blood flow, and then you add repetitive stress on top of that, messing up the circulation even more. No wonder that spot is so often affected by OCD.
You got it, Dawn. And knowing how anatomy and biomechanics work together, that's crucial for treating and preventing OCD. We can't just treat the symptoms, we need to look deeper at what's causing the problem in the first place.
Like detective work, right?
Yeah.
Piecing together the clues to solve this knee mystery.
Absolutely. And this medieval case, it adds another clue. It tells us that repetitive stress and blood supply problems, they've been around for a long time.
Amazing that we can learn so much from a skeleton that's over 1,000 years old. Yeah. But we're just getting started. We've talked about the possible causes, but the big question is, how does this ancient case help us understand OCD today? That's what we'll be tackling in part 3. So stick around. We're going to look at what this means for modern treatments and prevention strategies, comparing what we've learned from this medieval case to what we see in our practice now.
It's going to be really interesting to see how this old knee mystery can help us figure out the future of OCD treatment and prevention. Make sure you're here for it.
And we're back. Last part of our deep dive knee detectives. You ready to wrap this up, March?
Let's do it. We've been all over this ninth century OCD case, looked at the causes. Now, the big question, what does it all mean for treating and preventing OCD today?
Right. We've traveled through time, examined those ancient knees. What lessons did we learn?
Well, I think the biggest takeaway is that OCD has been around forever. It's not new. It's been bugging people for centuries.
So it's not just a modern problem.
Exactly. It tells us there's something deeper going on. More than just a one-time injury or overuse. There are these underlying factors we need to understand.
You're right. It's like a puzzle with a bunch of missing pieces. And this medieval case gives us a new piece to try and fit in.
Right. We're seeing OCD from a different angle, a much longer view. And that makes us rethink how we approach it, how we treat it, how we prevent it.
So how do we take what we've learned and use it today? What can we actually do to deal with OCD better based on this medieval case?
I think one of the biggest things is we have to treat the root cause, not just the symptoms, like we were talking about with repetitive stress.
So if someone's doing the same movements over and over again, causing those little injuries, we need to stop that cycle.
Yeah. For athletes, that might mean changing how they train, improving their form, making sure they rest enough. And for people who aren't athletes, we might have to look at their work habits, their hobbies, even just everyday things that could be stressing their knees. It's all about figuring out what's going on in each person's life and finding ways to make those changes.
So no cookie cutter solutions.
Nope. Every person is different. And what about that blood supply issue? Knowing that one spot in the knee is prone to problems, can we do anything to improve the blood flow there?
Interesting question.
There are some really cool new treatments that focus on blood flow and circulation,
Huh.
like platelet-rich plasma injections or even stem cell therapies. They're all about helping that area heal and regenerate by giving it more nutrients and growth factors.
It's amazing how looking back in time can spark new ideas for research and treatment. It shows that we should always be open to learning from the past.
I completely agree. And on top of those treatments, this medieval case also reminds us how important prevention is. If we can figure out who's at risk for OCD because of their genes, their lifestyle, or other things, we can step in early and maybe even stop it from happening in the first place.
That's a big deal, March. Shifting from reacting to a problem to preventing it in the first place. And it brings us back to that idea of personalized medicine, treating each person based on their own unique situation.
Absolutely. It's about giving people the knowledge and the tools to take care of their own knee health and working together to find the best solutions for each individual.
Couldn't have said it better. So as we wrap up this awesome deep dive, what are the main things you want our listeners to remember about OCD and this trip back to medieval times?
Okay, so first, OCD is an ancient problem. It's been around for ages. This tells us there's more to it than meets the eye.
Right. It's a complex condition.
Second, this medieval case shows how important repetitive stress and blood supply are in OCD. Understanding those things can help us come up with better ways to treat it and prevent it.
And those strategies can help everyone, not just athletes. Anyone who wants to keep their knees healthy as they get older.
You got it. And lastly, this case shows how important early intervention is. If we can catch it early and take the right steps, we might be able to avoid OCD altogether.
It's like having a knee health guidebook, written over centuries of experience and observation. So next time you hear about OCD, remember that medieval teenager from Croatia? Their ancient knee has a lot to teach us. Lessons that can help us take care of our knees and keep them happy and healthy for years to come.
Couldn't agree more. And don't forget to like, subscribe, and hit that bell for more amazing knee content on our YouTube channel. We're always exploring the world of knees and sharing everything we learn. Keep those knees strong and keep on exploring.